Health Outreach and Programming with the All of Us Research Program in Public Libraries. During this presentation, our goals are to learn a little bit about the All of Us Research Program and some of our partnerships with libraries, some lessons learned, and really excited to spend a little bit of time with you today. We encourage everyone to use the chat and Q&A features. My colleagues Jen and Linda are here today to assist with anything technical and to answer questions in the chat. But at the end, if anything has not been answered, we will go ahead and answer some questions and have a little discussion. So I'm joined here today. My name is Michael Balkenhol. I am the engagement coordinator at the NNLM All of Us Program Center, or NAPC. Might be using that during the presentation. I'm joined by my colleagues Lori Stearns. She's the engagement director at the All of Us Pennsylvania, and Michelle Lesniak, who is the director of South Butler Community Library. All of us are here in Western PA. A little quick agenda today. So welcome, a little bit about us. We're going to talk a little bit about All of Us, the NAPC, as well as All of Us Pennsylvania, some of our projects that we have going at South Butler Community Library. I'm really excited to share. And then before we wrap up, I'm going to share about how your library might become involved with All of Us before we move on to our Q&A. We're going to launch a quick poll just to see how familiar our audience today is with the All of Us Research Program. I will kind of get going here. All of Us, or the All of Us Research Program, but All of Us for short, is a research program of the National Institutes of Health. All of Us is building one of the largest and most diverse health databases of its kind, and researchers are already using this data to learn more about why people get sick or stay healthy, what makes each of us unique, and they're learning this information. They're using this information to find better ways to treat and prevent illnesses and care for all of us. All of Us is seeking 1 million or more people across the US to advance medical research, and people who join All of Us share information about their health, habits, and what it's like where they live. All of Us is focused on inclusion of people and communities underrepresented in biomedical research. So we might talk about that a little bit during the presentation as well. So underrepresented in biomedical research, or UBR communities. We'll be dropping some links in the chat to learn more about everything as we move through. Specifically, the NNLM All of Us Program Center is a part of the network of the National Library of Medicine, and it's a partnership between the National Library of Medicine and All of Us. We support All of Us through two main goals: engagement with public libraries, which includes training, funding, and partnerships, as well as providing training for All of Us staff across the US. The NAPC, where I work, is based out of the University of Iowa Hardin Library for the Health Sciences, as well as the University of Pittsburgh Health Sciences Library System. Sharing here some of our current and past projects that we've supported, as well as where to learn about engagement and enrollment partners. All of Us is a consortium of engagement and enrollment partners, of which All of Us PA is one, where Lori works. And the NAPC supports activities and projects in public libraries that align with both community need and interest, as well as with the goals of All of Us. Libraries offer value as partners for a variety of reasons, but including being open to the public and free to use, and being focused on learning, privacy, access, and invested in community health. Partnerships with public libraries serve All of Us enrollment, but we focus on ensuring bidirectional benefit by providing a variety of partnership activities and options and funding to support special projects in libraries. Wanted to share a little bit about the types of activities that we support between All of Us partners, including Lori's team at All of Us PA, as well as other All of Us partners across the country. So health programs and special events, thinking traditional library programming like author talks, film screenings, and health fairs. All of Us enrollment pop-ups, as well as library staff engagement and training. Sometimes as simple as distribution of informational materials to get people to learn a little bit or be more aware of what All of Us is. Hosting the All of Us Journey. And if you're not familiar, the Journey is a traveling exhibition that features interactive stations designed to help visitors of all ages learn about precision medicine research. And then we also work to establish relationships between All of Us partners and other library partners like local community-based organizations. Okay, and before I pass things off to Lori to share more about All of Us and All of Us Pennsylvania, wanted to share that I started to work closer with Lori and Michelle in 2020, which is somehow 4 years ago. And during the early days of the pandemic, the NNLM All of Us Program Center, so the NAPC, All of Us Pennsylvania, and our partners at SciStarter hosted virtual citizen science programming for several public library partners, including a learning opportunity about participating in research about light pollution that we held with Michelle from South Butler Community Library. In 2023, so moving forward a little bit here, All of Us and the National Library of Medicine offered a funding opportunity for public libraries to help bridge the digital divide and support All of Us enrollment and retention activities. So the South Butler Community Library is one of 11 recipients of these awards, which were the All of Us Virtual Library Center Award. And I'll be back later to talk about NAPC projects with public libraries, as well as other partnership opportunities. But without further ado, I'm going to pass it to Lori to talk a little bit more about All of Us and All of Us PA.
Thanks, Michael. And you can go ahead to the next slide too. Hi, everyone. One of the things that I really want to share, the next slide, Michael. One of the things that I really want to share is that, the All of Us research, it didn't, go back one, please. It didn't show on my screen, slide 10. Okay, well, one of the things that I want to share is that the All of Us research program really is dedicated to precision planning. And my cute little graphic isn't showing up, but really, if you've ever seen the strategic framework of the planning process, it involves assessment, implementation, planning, and evaluation. And when the All of Us research program started, we were sure to share with everyone that our goal for the outcomes for the research program were that we could get to precision medicine. And that means that's the concept of ensuring that individuals get the right treatment for them at the right time. Well, when the engagement team from All of Us Pennsylvania is working across the state with our community-based organizations, we do precision engagement. And you can see on the photo here, the slide that's showing, this is our engagement team at the top. We gather together once a year and we talk our strategy. There it is. There's my planning process, but that's okay. You can move on to the next one. Thank you. So the engagement team gets together when we really design our strategic planning process, because the state of Pennsylvania is quite a large state. And we have 67 counties, and we are housed at the University of Pittsburgh, which is actually on the far western side of the state. And we are responsible for the entire state. And we never forget that. We never forget that we're responsible. We are All of Us Pennsylvania, not All of Us Pittsburgh. And so our engagement team works collaboratively with our enrollment team, which is about another 20 plus members, to fan out across the state and do what we can to welcome individuals. And one of the things that we typically do is speak to our community-based leaders, and oftentimes those are libraries. Michael, can you go to slide 12? Thank you. So for individuals who do want to participate in the research program, I just want to share the steps a little bit. So the steps involve really two major elements. One is completed online and one is completed in person. And I want to share with you how you as library directors can help us with both of those. But for individuals who do want to enroll, the process is fairly simple. It takes about 2 hours total. And for individuals who are comfortable with an online experience and they have good digital bandwidth, they can complete that part from home. That is reading their consent forms and completing some surveys. That part takes the majority of the research participation, which is maybe an hour and 15 minutes or so. But for individuals who are not comfortable or who don't have a good digital access, then the libraries can help us by providing support. Also, our clinical teams will provide support. So people who would like to come and complete their online consents and surveys with us on site can do that. And we're happy to help them, but we also lean on libraries to help individuals develop their email address or to get access to the consents and surveys. And then the second part, the individual completes some body measurements as well as biosamples with our clinical team. And believe it or not, we also do that part with libraries. We actually send our clinical teams out to the communities to be sure that we are welcoming individuals who couldn't otherwise get to a research center so that they can give their voice to this research program. The biosamples include a blood draw and a urine sample. And yes, we do draw blood in libraries, and we can talk a little bit more about that, but our teams will bring in everything that they need and take out everything that they brought in to complete those biosamples, including privacy screens. So that has been something that has been really powerful because it feels very welcoming for individuals to come to a library. Next slide, please. So, we're aiming to enroll 1 million individuals across the country, and we are so proud. We have enrolled in all of the steps, including those biosamples, more than 500,000 individuals. That's a really powerful data set for a research program. And we have another 200,000 individuals who have started the steps to join the program. So the All of Us research program is really powerful, and we are very proud of the work that all of us and our community partners have already contributed. And I want to say that if you've ever participated in or know of people who have participated in a research study, you know that generally you have one research question and one research participant, and they answer just the one question for that research participation. But with the All of Us research program, our participants participate in just that one visit, and they have already contributed to over 8,000 research studies. That is something that is just tremendously powerful. We think it will speed up research. It certainly will reduce costs for research. And if you're interested in seeing the kinds of things that are already being studied, you can go to researchallofus.org, which is listed on the slide as well as in the chat. And the information is publicly available, and you can dive deeper into the data browser as well and see what kinds of research studies are happening on this data. We're so thankful for our participants. If anybody watching, if anybody participating today in the seminar is a participant in the All of Us research program, I want to say sincerely, thank you. Thank you for being one of us. You're helping to contribute to really changing the future of medicine, and we couldn't do this without you. We also can't do this without our partners. So next slide, please. Thanks, Michael. When I walked into South Butler Community Library, this rural library not far from my neighborhood, and I introduced the program and I talked to Michelle and I asked her if she could help, and I told her why I thought it was important. I was really thrilled that she said yes. And I will let Michelle take it from here and let you know why she said yes and what has been the benefit of her partnership with the All of Us research program now. Thanks.
Well, hello, I am Michelle. Lori, I'm so glad you remember the day we met and talked about All of Us. It was a great thing that you approached us because I did want to say yes. And that partnership continues to be transformative and beneficial to our community. So I'm so happy to share with things today. So just a little bit about myself in the library. I've been director for 7 years after being 25 years in business. So I did a lot of volunteerism prior to that. So I bring a unique perspective because the library world was a second career for me. So I think that helps to just put into perspective how I feel things may be a little different than a standard library isn't just books. Our library is located north of Pittsburgh. It's in Western Pennsylvania. We serve 6 rural municipalities which surround the historic town of Saxonburg, and we are the center of town. We are one of 9 libraries that are in our county federated system, which means we operate independently, but we do share some resources like catalogs and digital databases and things like that. The picture shows our front patio. Since we're in the middle of the town, it's a band playing at a community event. Lots of people around, and it's always busy when we host something. But every day we have benches and tables, and people stroll through town and stop by just to sit and relax in our area. And we're really happy to be that space. So offering health education has always been a top priority for us and for me. I think we have collaborated with a lot of great local organizations to offer a variety of programs. We have a local Medicare specialist we work with. The Food Institute of our local hospital has hosted both virtual and in-person programs on our site. We've worked with the Area Agency on Aging and some of the healthcare providers themselves. The one outreach that we've done is the cabin fever escape, which we did during the last Winter Olympics. And it was for older adult populations. They're not used to getting take-home bags, and kits. So we created a kit that had some kits and swag from our Area Agency on Aging, along with some DVDs we added with puzzle books and trivia questions for them to complete, and they get a prize. And then we had several Olympic themed activities. So that kept them busy during the cold winter months. And they were really happy to have that we had thought of them instead of not just the kids. And so we're happy to wrap that into our health, not being by yourself in those winter blues. So we've had interaction. I've had interaction with both National Library of Medicine and All of Us since 2017. NLM was one of the first things I found as a new director, that they had some interesting webinars I attended, newsletters that kept me up to date with some information. After meeting with Lori in 2019, and I started to become more active in our Pennsylvania Library Association, and also their PA Forward initiative. We definitely here at the library became a little more focused on some of the education opportunities we could do for health. And I did enjoy collaborating with Lori and Michael for Globe at Night webinar in 2020. I know that our community was excited and impressed that even during such a challenging time, the library found a way to be relevant in a new way. So the many kudos to having a partnership that works with you on all types of events. So our partnership with All of Us, I think it is my quick yes answer to Lori isn't surprising because they just offer so much. We're a rural community. We're often overlooked by programs that seek to impact large numbers of people quickly, but finally we were included. It's the inclusion of our community, the rural, and they think they really felt that in the community. And another reason I said yes is because I just saw the depth of what All of Us and NLM had to offer. They have personal connections with local organizations that I didn't even know existed. And all the education materials and programs were diverse and engaging, so easy to use and easy to put into use at the library. And also, I appreciate that they were interested in building not just a single event, but they really had a long-term commitment to engaging with our community members and finding ways to make them healthier. So since 2019, we've partnered for at least five All of Us enrollment days. And we also have had information tables at our library and in the community events that we host. And I can tell you that planning and conducting the enrollment days is easy for the library. We select the date, working with All of Us, display the provided event flyer they give us, and then just prepare a space. And the team at All of Us handles everything else. They schedule all the participants in advance of the enrollment day. They do the publicity. I get postcards in the mail, and there's things going on social media. And then they bring everything they need with them, so you don't have to worry about anything. It is impressive. They bring the van, arrives, all the team members roll in the carts and the equipment. They set it up, the computers, everything, scales, blood draws, all that in less than 30 minutes, and everybody's ready to go. And they're always so kind and wonderful and professional. So we always feel really good about having them in our space. And the library can play an important role. Our public computers are available if they need to, enrollees need to access that. If they need help setting up emails, like Lori said, anything on the digital side, we use our public space to do that. So it's a great way for us to interact with when needed. So one of the things is that PA Forward is part of the initiative, Pennsylvania Library Association, and the initiative states that libraries are key to providing 5 types of knowledge that are essential to a community's success: basic literacy, civic and social literacy, financial literacy, health literacy, and information literacy. So focusing on health literacy, it's necessary because, a couple statistics for you, only 12% of US adults have the health literacy necessary to navigate our complex health system. So that's kind of sad, that people need more information. And hopefully this is one of the ways we can get it. And they say your average mid-sized local hospital, they say, sees about 5,000 patients a year. They actually spend $1.8 million covering the costs of the health literacy that they have to provide as part of their services as well. So a better informed community also allows for better health interactions with their providers. And the populations, as we might expect, that most likely lack health literacy are those over 65, minorities, immigrant populations, and the Medicare, Medicaid recipients. And I know in our area, those are plentiful. So things that we do will definitely benefit a lot of people in our area. And if you think about the role of libraries have in teaching health literacy, I'd like to share the quote that's on the slide. It says, "With the right support, libraries are ideally positioned to become the community centers of information, technology, and learning that will fuel educational and economic opportunity for all of their citizens." I really believe that NLM and all of us partnerships really provide this right support. So it's definitely for us and for anyone that considers health literacy a top priority to get involved with these organizations. So I just want to move on and tell you a little bit more about our library as we lead into what we're doing with our virtual library center. Our library building is a single-story building, 6,000 square feet. It's divided into 3 sections. We don't have any meeting rooms. It's very open air, and so everything is open. So we use mobile wall dividers to create some private spaces when we need them. The 2 photos on the left show our children's room, which is crowded with activity. One of them are during our story times. We have over 25 families, more children each day participating in those. And it's also a space that's central to our Summer Quest program for all of the youth. And then on the right, you'll see one of the main areas that we're doing renovations for. It is our young adult room that's often used for small group meetings. The walking path through the room, if you can tell from the pictures, is diagonal, cutting right through the middle. And it creates 2 small triangles on either side. So while we try to use that for meetings or activities, it's very inconvenient to have people walking back and forth in front of you or behind you. So on the other end of the room where you can't see it, we have actually an express window. We've had a drive-through window since COVID. And we will keep that on that end of the room. That is something that's a good service for us, and it's too popular to not have. So the next photo you'll see is the photos of our main room. So that this room was renovated in 2018 by a donation that we received from an estate. The layout of the shelving that existed at that time, we didn't have space for any large group activities. If we could get 20 people and 20 chairs squeezed into any little area, that's about what we could do. Anything else was standing room only. So our renovation plan was to make that space flexible and dynamic. And that means that all non-movable shelving was placed on one long wall of the room. Everything else in the room, shelving, tables, chairs, had to be mobile. Everything we have is on wheels. So all of the mobile furniture then can be moved to the side of the room with all the stationary shelving, and the whole middle of the room opens up. And that allows us to put at least 12 8-foot tables so we can host a book sale or a vendor fair. And it also can handle 125 chairs to seat people for a presentation, which we've done several times. So the photo on the left shows us, we have an indoor mini golf fundraiser every year, and that shows 18 holes of golf that we lay out in the entire library. So we were able to get a lot of space for that. And on the right, you see the rolling shelves, the compact shelving on the right-hand side, and a book sale in progress. So that room is already well situated to do large group presentations for health related activities to do with all of us in the NNLM. So where we're moving for the Virtual Library Center, the National Library of Medicine, with the support of NNLM, All of Us Program Center, awarded 11 public libraries with funding to develop these VLCs, Virtual Library Centers. And as mentioned before, we were one of those lucky libraries. The Virtual Library Center builds the infrastructure within public libraries to help bridge the digital divide, support the All of Us enrollment and retention activities. They offer meeting and program spaces, accessibility, and privacy and technology. So this picture shows our very first project that the grant was going to be used for was that to correct that annoying traffic pattern we had through that young adult room. You can see that you're in the children's room looking towards the young adult room, that we have opened the door, which aligns directly with our main room, so we don't have to cut the room in half. And with the new door, the library is transforming to meet the needs of the community. Now on the children's side, we will have a better space for our story times and things that also aren't interfered with by a walkway. So a lot of things that correct, but when we go in the other side, the meeting space is valuable for the Virtual Library Center. So the result will be a meeting area that will have small private room for community members to have health interactions via video conference education using virtual reality headsets and the ability to print, scan, and review health records on their own. And the library staff will be available to train them or help them as they need to utilize the technology so that they feel at ease when they're in the library. So in this next picture, you'll see our virtual library center is going to be called Health Matters at South Butler. So Health Matters really encompasses everything that the grant is allowing us to do to increase our technology, have more health resources, be able to better accommodate the All of Us enrollment and retention activities. We're going to do enhanced health-focused lending kits and lending items, events with healthcare providers, and programs with some of the local nonprofit organizations who actually provide resources to our community members as well. So the digital access is really important to our community because many families here do not have internet or computer access at home. So we know that we have hotspots here now, but by having technology at the library, we'll be able to educate and assist people more with those computers, their laptops, hotspots, emails, internet in general. They just need help for all of those aspects of technology. So on the left of this picture, you'll see a photo of our young adult area under construction to create the meeting spaces. In the far where you see the black wall will be a small meeting space. And then in front of that will be a larger area with folding doors that we'll be able to open and close to utilize the space as we need it. And then on the right, you'll see a photo of our staff break room on the top, and the staff without hesitation said, yeah, let's do it. We divided it in half, and we're going to take half of it is going to be a smaller staff break room, and the other half is going to be a private interaction space for our community. So they'll be able to, that will be fully equipped with technology so that they can do everything in private and not be afraid of somebody looking over their shoulder or sharing, and they'd be able to video conference and do everything there. So that's a valuable space so that we can assume all of the things that we can do as a virtual library center. So next slide. So in addition to all the private health interaction rooms, the meeting rooms, and the technology that's already been mentioned, our backyard pavilion, which was built last year, is also going to be equipped with shades to make it available for programming here in Pennsylvania during 3 seasons of the year. And that way, programs such as Gardening for Healthy Living, we have a very robust Master Gardeners program here, citizen science projects and yoga movement sessions, we'll all benefit from being outside and in the environment. And as we know, health is so connected to our environment. So it's great to be able to use the outdoors for some of our programming as well. So in closing, I just challenge every library to explore the opportunity to work with your local All of Us program and the resources of the National Library of Medicine. My connection with people like Michael and Lori have improved the quality and variety of health programs we offer. And the potential funding for programs, both for large and small projects, is definitely a benefit to libraries of all sizes. And I really see these two organizations and their partners as organizations that are forward thinking and always constantly offering new ways and new information to assist us, the libraries, where people really go to learn, grow, and feel connected to the community and its resources. So, Michael, would you like to share some more about the information about funding opportunities and partnerships with All of Us?
Yeah, and thank you so much, Michelle and Lori, for sharing so much about your work and your community. Before we move on to some Q&A, I'm going to share a little bit more about how you or your library might partner with All of Us, talk a little bit about our funding opportunities, and more. So the best way to learn about ongoing partnership training and funding opportunities is to subscribe to the NAPC Digest, which is our bi-monthly newsletter from the NAPC. If you get it, you might know that this month we offered a funding opportunity that closes tomorrow, so there's still a little bit of time to apply to support travel costs for library staff to join us at the Public Library Association Conference this April in Columbus, Ohio. So we're going to drop information about that into the chat. But again, subscribing to our newsletter is the best way to find out about opportunities as they arise. A little quick overview of our funding opportunities. So the NAPC offers funding to public libraries to support projects and partnerships with local All of Us partners. Excuse me, we learned a little bit about work that happens in Pennsylvania, but there are All of Us partners across the country. For the projects and partnerships that we fund, all the library activities include All of Us healthcare provider organization, so All of Us enrollment partners. Wanted to just mention that the Virtual Library Center Award, so the award that Michelle's library received last year, has closed. We don't anticipate that that would open up again, but there are ongoing partnerships for conference engagement and training, as well as our Partnership Project Award, which is a larger award, as well as event support to really support kind of like one-off events or opportunities with All of Us partners in your area. So wanted to share again that the NAPC works nationwide. So these are locations of our virtual library centers, as well as this year's Partnership Project Award and our Event Support Award. So the first one is there for Memphis Public Library. We will share the link as well so that you could peruse who has been working with us lately. For the Partnership Project Award, so again, this is a little bit of a larger award, usually at like the $30,000 award point. Wanted to just highlight some of the popular activities that are happening with our Partnership Project Award. So mostly focused on health programming and special events, as well as staff engagement. Plans to share informational materials through the library, as well as hosting enrollment pop-ups and coordinating with local organizations. Sacramento Public Library is doing some nutrition-focused programming with author talks and cooking demos that are really exciting with their local All of Us partner, which is located at the University of California, Davis. Looking at a smaller award, so the Memphis Public Library hosted the All of Us Journey. Shared earlier that All of Us, the Journey is a traveling exhibition. Memphis Public Library hosted it in May 2023 and wanted to just share that there was like really great benefit for the library as well as for All of Us, and that All of Us was able to speak with 284 people at the library that day. 55 people opened an account to start the process to enroll in All of Us, and 36 people completed the program, or at least initial participation by donating a biosample. So there's always opportunities for smaller one-off partnerships as well as more extensive partnerships as well. The entire network of the National Library of Medicine focuses on crowdsourcing and community science. One of our great partners is SciStarter. They are an organization that works to promote public participation in science, in particular projects that require crowdsourcing as far as citizen science projects go. Over the last few years, again, Globe at Night was one event that we hosted with the South Butler Library. But every year for April, we support Citizen and Community Science Month events at libraries across the country. Last year, just to give a little preview of something that has happened more recently, we held a handful of events with the All of Us California team that included over 400 people registered for the events, 500 views within a month of it, as well as 269 unique zip codes. So reaching people really from across the country, even with an event that was focused mostly on the state of California. We are planning for April 2024 events. There are lots of partnership opportunities or resources for you to throw your own event at citizensciencemonth.org. And with that, we're going to launch the second part of that poll to see if you've learned maybe a little bit more about All of Us. Thank you, of course, for your time. Lori's contact information, Michelle's and mine is here as well. So please don't hesitate to reach out. But I think at this time, I haven't been taking a really close look at the chat. But if there are any questions that we could resolve, let us know.
Just to let you know, Michael, I have been watching the chat and I have answered a couple questions, but I would appreciate anybody speaking up at the moment to ask us anything else.
And if you can see the results that from our poll, thanks for participating, folks. Looks like folks learned a little bit more about All of Us, which is great. So let's see. If there hasn't been a question or a comment that you would like to make, please feel free to throw it in the chat, or we can let you unmute.
So I see a question from Katie about whether All of Us is in every state. Katie, yes. All of Us research program is available to anyone who lives in the United States. And you can actually go to joinallofus.org, which is in my, you can see it in my little visual graphic, and it's also in the chat, but joinallofus.org. And individuals who don't have a local partner, the way we have in Pennsylvania, can still join. You would just join remotely. And there are various ways to do that depending on where you live. Sometimes there are partnerships with CVS locations or with Quest Diagnostics to complete your biosamples. And if those don't exist, you can actually do a saliva kit by mail, and that's really helpful. And in fact, for individuals who need to do a saliva kit by mail, if they also go into their portal once they become a participant and enter their own body measurements so that things like BMI can be captured, then that's actually tremendously helpful to the research investigators. So even if there's not a partner in your neighborhood, or even if you can't find a location that's convenient for you to go and enroll, you can do it remotely. But if there is an All of Us partner in your state, and you as a librarian would like them to come and do programming or send in a team to complete enrollments, they might be able to do that. Not every state operates exactly the same, but that would be my answer to your question. I'm happy to answer any follow-up questions about that as well.
I also saw a question about if the slides will be available, and for sure we'll be uploading a PDF of the slides either onto the course in vFairs, or feel free to email me if you don't end up seeing them. Happy to send a copy your way. Any other questions? Maybe not. Always happy to give folks a little bit of time back. And again, know we shared tons of information, follow-up questions. Don't hesitate to email any of us. It would be great to hear from you. If you are from public library, of course, really interested in chatting anytime about local partners in your area and different opportunities for programming or partnerships or funding. And of course, the best way, of course, to stay in touch is through our newsletter. Send out lots of good information there. Yeah, and then for the PLA conference again, the application for that award closes tomorrow. But we would love to support some library folks to join us at PLA. Got some fun stuff planned for the conference. And I think with that, I will stop sharing my screen. Thanks everyone for joining us. And we'll close the room soon, but happy to stick around if there's any last comments, questions, if anyone needs anything. Thanks again, everybody.